Our top focus story continues to remain the developments from Western Uttar Pradesh. A viral fever has claimed 60 lives, including 50 children, in the last 10 days. And these are just the official government figures at the moment. The government is calling it a dengue hemorrhagic fever, or a severe form of dengue. Firozabad is the worst affected district. Other districts in Western Uttar Pradesh like Mathura, Agra, Hapur, Bulandshahr also continue to remain badly hit by this new viral fever. Hospitals in many parts of the state are running at full capacity. Beds are running short, especially for young children.
घंटे के अंदर प्लेट तैयार करो, मैं कहाँ से लाऊं? मैं खुद देवे लाग रहा हूँ, अभी बिल होता है, मैं दे लूँगी ऐसे कौन? हैं? अब ये लोग मेरे बच्चे को ठीक कर दे।
ब्लड की कब बोला था, कब देना था ब्लड आपको?
आज बोला है अभी। अब सच्चे करते हैं पत्रकार लिए ये देखा।
And my colleague Meher Pandey has been reporting from the Firozabad district, which is among the worst hit as far as this viral fever is concerned. She spoke with a local doctor at the district hospital. Here's what she had to say.
We are here in Firozabad at the hospital and medical college designated to treat most of the dengue cases coming up. I'm here with the dean and principal, Dr. Sangeeta Aneja. तो मैम यहाँ अभी कितने लोग एडमिट हुए होंगे?
383 patients at this time, and we have discharged 118 patients in 24 hours.
तो मैम ये 100 बेड का हॉस्पिटल है ना, लेकिन अब आपने कितने बढ़ा दिए होंगे?
यहाँ पर अप्रॉक्सीमेटली 400 के आसपास हो गया है बेड. हम लोग एक सामने के बिल्डिंग है, उसमें हमने थोड़ा रिफर्बिश करके उसको जो है, मतलब नई बिल्डिंग है, थोड़ी तैयार हो रही थी, अभी टाइम था, बट वी हैव प्रिपेयर्ड इट. 100 बेड और स्टार्ट कर रहे हैं और कल तक 100 और करके 600 पेशेंट्स हो जाएंगे, किसी को तकलीफ नहीं होगा. जो शहरों में, गाँव में लोग इलाज कराए हैं, प्रॉब्लम उन्हीं में आया है कि घरों में बुखार लेकर बैठे रहे हैं या किसी क्वैक से इलाज करा लिया है और एकदम से तेज़ दवा ले ली है, और प्लस बच्चों में थोड़ा डोज वगैरह उनके वेट के हिसाब से नाप के दिया जाता है, तो उसमें गड़बड़ी हुआ है, तो उसकी वजह से प्रॉब्लम आया. नाउ बिकॉज ऑफ आई थिंक समटाइम्स इट्स अ थोड़ा सा पैनिक इज़ ब्लेसिंग इन डिस्गाइज कि जो है पेशेंट्स हल्का सा भी बुखार होते हुए आ रहे हैं, तो उनमें रिकवरी बहुत अच्छा हो रहा है कि सिंस 24 आवर्स कोई डेथ भी नहीं हुआ है, और उनमें हल्का सा भी बुखार आने पर यहाँ आ रहे हैं. और यहाँ सारे स्पेशलिस्ट शासन ने दे रखे हैं, 25 स्पेशलिस्ट आर वर्किंग ऑन इट. तो उसमें क्या है कि बच्चे के वेट के हिसाब से, सिम्टम के हिसाब से दवाइयाँ दी जा रही हैं, तो टाइम लगेगा, बट दे आर रिकवरिंग वेल.
Well, this is a story that's clearly gripped the attention of the nation. What is this viral fever? What are the symptoms? What does one need to be watchful about, especially since it concerns children? Dr. Krishan Chugh, Director and Head of Department Pediatrics, Fortis Memorial Research Institute, Gurugram, joins us. We also have retired Lieutenant General Dr. Vipin Puri, Vice Chancellor of the KGMU, the King George Medical University, joining us. Thank you both very much for sparing your time and being with us. Dr. Chugh, I want to begin by asking you, it is a very deadly viral fever from what we are learning. Prima facie, government officials have clarified that it is some kind of a severe form of dengue, a dengue hemorrhagic fever. Can you break it down for our viewers? What are the symptoms that people need to be watchful about?
Well, dengue hemorrhagic fever is a comparatively more severe form of the dengue fever. It starts as a fever. From the beginning, how we can suspect it is that this is the season, and in this season if fever comes without any much of respiratory symptoms, no cough, cold, and suddenly goes very high, we should be suspecting that it can turn out to be dengue fever. Now we have tests available which can diagnose it on day 1 also.
Right.
So once diagnosis is made, it is much easier. Now we follow this patient. The fever may persist for let's say 3, 4, 5 days. Majority of people will recover from this, but a few of them will go into what is called dengue hemorrhagic fever or dengue hemorrhagic fever with shock. Those are the two worst forms of it.
Okay.
Dengue hemorrhagic fever, what happens is the platelets start going down, the coagulation system fails, and the child starts bleeding from here, there, and almost everywhere in the body. And because of this, and also because of other changes in the intravascular compartment of the child, what goes on inside is that from the blood it leaks out into the tissue. So very
All
much
right.
less.
Dr. Chugh, I'm going to interrupt you there because we seem to be having a little bit of an audio glitch with you. We can't understand you very clearly. So we're going to try and fix that audio line with you and come back to you because I think you're making very important points and I'm sure viewers want to clearly understand that. Let me bring in Dr. Puri into the conversation. Dr. Puri, we were talking about typical symptoms and, like Dr. Chugh explained that a high fever or a fever that escalates very quickly, not typically accompanied by, a cold and cough, is suspected dengue. Now, at a time when we're already dealing with the COVID-19 pandemic, the first instinct is that if you have a fever, you go ahead and get a COVID test. How do you know whether you need a COVID test or whether you need to get a blood work done in order to identify whether it's dengue or some other infection?
Absolutely. I think a very, very pertinent question. And without doubt, what you say is right. And that is that an RT-PCR for COVID infection is a mandatory requirement. So that means an RT-PCR for COVID should be negative. Serology for dengue should be positive and can be further confirmed on a PCR and try and do the various ELISAs for the serotyping of which type of a dengue fever it is.
Okay.
Now, so I think it's very important to try and, as you very rightly say, first exclude COVID and then move on to what exactly is a positive fever.
But, the question then is that a lot of doctors have advised here, and we've been talking about this dengue fever that's gripped Western UP at the moment, that, acting fast, especially when it comes to children, is imperative. You need to take quick action. You can't let the fever fester or grow because that could prove to be life-threatening. So, at what juncture should you get tested? Should you wait for 24 hours, 48 hours? What do you recommend?
No, you see, the point is that the moment there is a fever in this setting, the RT-PCR is a prerequisite. That means the moment patient comes and RT-PCR is done.
Okay.
And within the next few hours, I mean, like here at KGMU, we are giving results within 4 to 5 hours for RT-PCR. And thereafter, you get on at the simultaneously, you also do a dengue serology.
Okay.
So these things is not that one after the other, it is all done on the same time.
And you're saying that the moment the fever comes, you should go rule out COVID and get your blood work done in order to ascertain what it is what is it that's causing the fever?
Absolutely, that should be the way to go.
Okay. Dr. Chugh, specific question to you. I believe we've managed to restore that line with you. Dr. Chugh, can you hear me?
Yes, right.
Very specific question about children, because if you look at the official figures that are coming in from Western UP right now, out of the 50 lives or more than 60 lives rather that have been lost, a majority of that is children, young children being severely hit by this viral fever. Why are children being affected in the manner that they are? And what is it that needs to be done when it comes to children developing this high fever? What's the advice that you'd like to give parents who are watching?
Why it affects the children more severely is something that has been observed for years now, that these dengue fever and some of the similar fevers that come in this season, what we call as tropical fevers, they tend to affect children more, probably because their immune system reacts somewhat differently to this compared to adults. And how to recognize the problem is that once the fever is occurring, as has been discussed, that we should quickly do the test. Once the test tells us that this can possibly be a dengue fever, or one of its what we call as differential diagnosis, which are somewhat similar in appearance initially. If it turns out to be dengue fever, there is no antiviral agent that can be used. But whatever effects that dengue virus causes on the body, they can be recognized, they can be countered, they can be reversed by appropriate interventions, whether it is giving intravenous fluids or whether it is by other means. But an antiviral agent does not exist.
Okay.
Once the patient goes into a phase where hemorrhages have started occurring, platelets have started falling, we generally do not rush with giving more platelets immediately. It is only when actual bleeding starts that the platelets are given.
Right.
The other component of this severity is that these children go into what is called the hypotensive shock. That is, the blood pressure starts dropping. Once that is happening, then there are special interventions that can be done in the majority of hospitals. And if once that stage comes and interventions are done,
okay,
majority of patients will recover.
Right. But you're saying, that early intervention is key. If your child has a fever that's escalated very quickly, you must absolutely rule out COVID, but at the same time get the blood work done almost simultaneously. A dengue test can come positive even in the initial days. You don't have to wait for a gestation period per se. I think that's very, very important. Dr. Vipin, very quickly, prevention. We know that this is localized right now to certain districts in Western Uttar Pradesh where this viral fever is really spreading. But what are some of the preventive actions that can be taken to prevent it?
You see, as you are aware, there are these public health doctrines that you do whenever there is some sort of a cluster breakout like this. We call it a primary surveillance, passive surveillance, active surveillance, and enhanced surveillance. A passive surveillance is wherein you get reports from various medical authorities, they keep telling you, and then you assimilate all this information. Active surveillance is what is happening now, that the public health authorities have moved into that area and trying to ascertain what exactly has gone wrong. So, right. And wherein you do a check of the disease, that is of the host, the okay. patients. Okay. You also do a surveillance of the vector, right. That is, and third, you also do a surveillance of the local environmental conditions.
Right.
So 3 types of surveillances are going on now as we talk, as far as the UP government is concerned. So okay. I think they are on it.
All right. Well, thank you both very much for joining us on the broadcast. I think it's extremely important to understand the symptoms, the precautionary measures that need to be taken at a time like this. We'll, of course, continue to bring you the very latest from Western Uttar Pradesh as this viral fever now is the big cause of worry. Thank you both very much for joining us.